Hi everybody, Ziv Simon here. I'm the creator of Surgical Master, the surgical training for dentists. Welcome to this video. In this one, I'm going to refer to a case that was sent to me by a dentist in Pakistan, and he was facing a very difficult combined Perio-Ortho case, and he wanted my advice on different types of grafting procedures. He sent me an email with a lot of questions and a description of the case. So Dr. Hasan from Dow Dental College in Pakistan, thank you for your email and bringing this case to my attention. It's a very interesting case, and I spent some time going over it, and you asked me about what would be my ideal treatment plan. How would I sequence the treatment? Would I choose free gingival grafting, connective tissue grafting, and a lot of important questions that are pertinent to this case. And I summarized them right here, and I'm going to relate to them as I go over this case. So definitely a very complex situation with significant teeth malpositioning and also mucogingival problems with recession and poor tissue quality. So it's easy to get overwhelmed just by looking at this picture. So I recommend focusing first of all on the goals of treatment and then the diagnosis, and then slowly but surely form a treatment plan and a treatment sequence that will match the goals and will also be appropriate for this patient's diagnosis. So Dr. Hasan told me that this patient is concerned with the obvious aesthetic problems. She already has some symptoms on the lower incisor teeth, and that there's also a concern with the long-term prognosis of the teeth because of the recession and severe mucogingival problem at a very young age. This patient is 22 years old. So we need to establish a periodontal diagnosis and also do an orthodontic workup and diagnosis and a treatment plan. I'm not knowledgeable enough about ortho to give you an opinion, but I'll definitely give you my 2 cents in regards to the mucogingival condition and what's the proper sequence. So looking at this patient at a very young age with severe teeth malpositioning and generalized recession, probably extending between 2 and 5-6 millimeters throughout the mouth. I also noticed inflammation, bleeding interproximally, mostly between the lower incisor teeth, and also problems with poor tissue quality. So there is not enough attached and keratinized tissue, and I understand your concern prior to orthodontic treatment that can potentially get worse. So your concerns are totally valid, and I'm happy you involved me with this case. Thank you for also sending me all the measurements of probings and recession and furcation. It would help to chart the mobility of each tooth. So we have this pre-operatively. You probably have it somewhere else. And also look at the full set of x-rays, not just the panorex. We have a localized periapical radiograph of the lower incisors where we see significant bone loss, especially at a young age. But try to look at every periapical individually and also at some vertical bite wings to help you reach a periodontal diagnosis. But anytime you have or you see severe bone loss around teeth in a very young patient, you should always suspect or be concerned with an aggressive type of periodontitis. So looking more specifically at the lower incisors, I noticed that the interproximal tissue looks white. It could be necrotic, and that is suspicious of necrotizing ulcerative periodontitis, or NUP, that can come hand in hand with aggressive periodontitis. We can definitely see the severe recession, the tissue quantity problem, but what you and I discussed privately was the tissue quality in terms of the amount of attached and keratinized tissue that can be a problem as this patient goes through orthodontic treatment. I also encourage you to look into the contributing factors, and the obvious is that the teeth are malpositioned and to some extent outside the bony envelope with dehiscences and fenestrations that are also contributing factors. There's also a strong mucosal pull in certain areas with aberrant freni. And if you look at the arch form, and I know you discussed or mentioned that you're planning extractions of premolars, look at the arch form. It's relatively narrow, and the ways to align teeth and widen the arch, not necessarily with extractions. So, you may want to talk this over with the treating orthodontist, but definitely severe crowding on the lower anterior teeth, and I see the benefit of extracting teeth, incisors, and ideally these should be the incisors that are the most compromised with bone loss. That would be my choice. So step number one, because we're suspecting an aggressive condition, I would refer the patient to a physician to conduct a full medical evaluation with blood tests, just to rule out any state of diabetes or any immune problems, anything that we can think is systemically related. You can get a bacterial sample just as a baseline and assess what type of periodontal pathogens are in her mouth, and see how these change with your treatment. And start with phase one, scaling and root planing with local anesthesia. Oral hygiene instructions, show the maintenance, make sure she's committed for a maintenance program, and also include the extractions according to the orthodontic treatment plan in this phase. You can then reevaluate her condition, and step number two is going to involve some limited grafting before orthodontic treatment. And the goal for this grafting is to improve tissue quality and to prevent some recession that we are anticipating throughout the orthodontic treatment. So if you look carefully at her mucogingival condition with the severe crowding and teeth malpositioning, the bone loss, the poor tissue quality in the mucosal pool, you can conclude that root coverage is not predictable at the moment. So the discussion about the different root coverage procedures, tunneling and coronal repositioning and all the things that you mentioned, I believe is not relevant at the moment, and I would focus on improving tissue quality. That can be done with a free gingival graft for the lower incisors, even if you're planning to extract a tooth, making an incision at the mucogingival junction, a split thickness flap, and a free gingival graft. And the goal is to improve the tissue quality, prevent recession, and also prepare the patient for orthodontic treatment. There is a video on the free gingival grafting technique that you can see on YouTube and prepare yourself for this procedure. So basically, this is my outline as far as I can tell from the records that you sent me. And again, thank you for sharing this interesting case with me. And starting with step one, which is basically an initial periodontal preparation with scaling and root planing, extracting the teeth based on your ortho treatment plan. Step number two is going to be pre-orthodontic grafting, and specifically I believe the free gingival graft is going to work well for the lower incisors. Then the patient can move forward with orthodontic treatment, and following the completion, you can consider more grafting, this time for aesthetics and root coverage, and the options will depend on the circumstances. Expect some of the recession to get worse after the orthodontic treatment, and you look at the conditions at that time and decide what is the best option for this patient. So I hope this outline is helpful to you, and good luck with this case. Feel free to email me and keep me posted about this case. Also feel free to share it with other dentists that have similar situations and may be interested in the more complex ortho-peri relationships. I'm so happy that you are sensitive to the soft tissues and you see this as an important factor in the treatment success. And I look forward to sharing more videos and educational programs in the future.